Peace be on you. I'm Dr. Mohammad Ali Hazratji. I'm a practicing neurologist in Western Massachusetts for the last 40 years. And I was asked to give some guidelines on the care of Muslim patients for the healthcare providers. So as healthcare providers, we have an obvious ethical and moral duty to offer the best possible care to every patient and to treat them as we would like to be treated. The Joint Commission mandates certain rights, which include the accommodation of cultural, personal, religious, and spiritual values. And in compliance with these accommodations, delivering high-quality care to Muslims in general requires an understanding of the differences in culture and spiritual values. Globally, Muslims represent about a fifth of the world's population, and Islam remains as the fastest growing religion in the world, and therefore it's highly probable that every healthcare provider will take care of a Muslim during their career. The Islamic faith and cultural background can influence decision-making, family dynamics, health practices, risks, attitudes, behaviors, and belief towards health and illness in general, as well as the utilization of healthcare. The Muslim faith encompasses several different ethnicities with various levels of adherence and practice of the faith. With diverse views regarding illness and healthcare. As a result of this, the care of Muslim patients may represent a challenge for a non-Muslim healthcare provider. However, by understanding some basic Muslim beliefs, its religious implications, values, and perspectives of family, health, illness, diet, etc., a person providing care should be able to provide competent, culturally sensitive, patient-centered care. Some of the main issues that come up are, number one, dietary restrictions, as Islam prohibits consumption of alcohol, pork products, and meats that are not slaughtered in the halal way, similar to kosher. Some Muslims may refuse all hospital food, and therefore it may be necessary to allow food to be brought in from home. If that is not possible, then providing eggs, fruit, seafood, vegetables, or kosher meals may be an alternative. Similarly, medications that contain alcohol, gelatin, or pork-based products are generally forbidden. However, in life-threatening situation, when no alternative is available, Islam permits the use of any drug, but this should be explained to the patient. Muslims also observe fasting during the month of Ramadan, where they abstain from food and all liquids, including water, from dawn to sunset. And this is a lunar month, and therefore it moves about 10 days each year relative to the solar calendar. And fasting may have some significant health implications, especially for those who are diabetic. So a patient who's planning to fast should be provided with a pre-dawn meal as well as a post-evening meal when they break their fast, preferably something that's rich in complex carbohydrates. And they should be given focused diabetic education regarding fasting. And a pre-fasting assessment of the diabetes is recommended so they are aware of the risks. And they should be told about the symptoms of hypoglycemia and instructed to end the fast if signs and symptoms of hypoglycemia develop. An adjustment may need to be made in timing of administered medications, particularly if these include insulin and oral hypoglycemic agents. Muslim patients should also be encouraged to monitor their blood sugar during fasting. Muslims who are chronically ill or elderly are exempt from fasting, and this also applies for people who are sick enough where fasting may be detrimental to their health. During a fast, it's permissible to administer eye drops and ear drops, dental care, inhalers, nebulizers, nasal sprays, immunizations, and insulin injections. However, nutritional supplements, intravenous fluids, and oral medications are not permitted. And if a person is ill enough to require these, then it warrants breaking of the fast. The second issue that comes up is prayers, because Islamic prayers are mandated 5 times a day, but they only take a few minutes. So their timing may interfere with medical care or with meal times, and therefore special arrangements may need to be made. The patient may pray in their own room or in a non-denominational chapel, whereas bedridden patients can choose to pray in bed. There is usually a ritual ablution or washing required before the prayer. If possible, the patient should be assisted in determining the direction of Mecca, which is northeast in America. And once the prayer begins, be respectful of giving the patient privacy, and it would be useful to put a sign such as, "In prayer, do not disturb," so there is no misinterpretation of the lack of response of the patient during the time that he or she is praying. The third issue is the importance of the family in Islam, that the family unit is the core of the community, and the strong extended family provides a support structure. And immediate as well as extended family members are often consulted in all important decisions. And Muslim patients typically receive multiple visitors, as there is an obligation in Islam to visit the sick. And the numbers of visitors can sometimes be overwhelming, and they may not adhere to official visiting timing and may require a gentle reminder of the visiting hours and the limitation of numbers of visitors. What is Islamic attitudes towards illness? For Muslims, health is a state of physical, psychological, spiritual, and social well-being, and is considered one of the greatest gifts and blessings of God. So taking care of one's health is a religious duty. Muslim patients believe that illness, pain, suffering, and even death are a test from God, and perceive illness as a trial by means of which one's sins are remitted. And therefore, in general, Muslims will receive illness with patience, prayer, and meditation. And even Muslims who are not actively practicing their faith may, in times of illness, call for spiritual counseling or religious intervention when they are facing significant challenges. Another important consideration is the idea of modesty, privacy, dress, and touch restrictions in Islam. Islam requires modest dress to maintain a moral and social order. Although these dresses may vary widely because of the country of origin of the person, some Muslim women will cover their hair with a scarf, arms and legs, and those who are very strict may have what's called an abaya, a complete black sort of a cloak, which is loose-fitting, as well as some of them may wear a veil, which is now fashionable because of the COVID infection. Everybody is wearing some form of a veil. Muslim patients' privacy and modesty must be respected. A few simple approaches, such as knocking before entering and announcing the arrival of a healthcare professional, will allow a female patient to cover herself as she prefers and will make her feel much more comfortable. Gender concordant care should be arranged as much as possible. However, and this is particularly so when there is gynecological or obstetric procedure and care involved. If gender-specific care is impossible, a female staff member or a patient relative of the same sex should always be present during examinations and preferably even during communications, and explain every step of the physical examination to the female patient. And if clothing needs to be removed, it should be removed as little as possible, and she should be covered as early as possible to minimize it. In many circumstances, a female patient, out of modesty, may avoid eye contact or shaking hands with a healthcare provider of the opposite sex, and this should not be misinterpreted as lack of trust or a sign of rejection. It's also customary for Muslim women to breastfeed their newborn babies in privacy. And these guidelines also apply for visiting Muslim patients in their homes. Another consideration is sometimes some Muslims may be following some traditional Muslim remedies, and it's good to inquire if they are taking any herbs or supplements or doing any other non-traditional methods, such as cupping for relief of pain, which is the bloodletting. Cautery used to be performed. Certain remedies such as honey is commonly used as a traditional remedy. Olive oil, from which the Mediterranean diet has been derived, is frequently used, and little black seeds, which are called Nigella sativa, are frequently used to treat a variety of gastrointestinal and respiratory complaints. Some miscellaneous considerations. Congenital disabilities are perceived as a test from God, and parents and family may not discuss the disability of their child. Circumcision. Islam requires males to be circumcised, and therefore Muslim parents often prefer their newborn males to be circumcised before leaving the hospital. Hospice care. Many Muslim patients do not expect the healthcare professionals to tell them or remind them that death is impending. It should be offered as providing comfort care for the terminally ill, because it's not uncommon for Muslim patients to not give up hope, even in situations like this, knowing that God is the creator of life and death and sickness and health, and that the time of death is predestined. There are some customs of which hand to use. Muslims eat with their right hand, and they prefer that things be given to them with the right hand. A word about mental illness. In some cultures, mental illness may not be well understood, and some may believe that depression and illnesses of this type are not possible if somebody is following the Islamic tenets, and therefore it may lead to rejection of medications such as antidepressants, antipsychotic agents, anti-anxiety agents. And one approach to combat this would be to describe these disorders as physical ailments. In matters of sexuality and domestic violence, Muslims tend to keep sexual matters private and to avoid discussing sexual relationships or sexual dysfunction, thereby making it difficult for healthcare professionals to diagnose problems and provide appropriate counseling. The discussion of the risk of sexually transmitted diseases is a very sensitive matter, and it can be misconstrued as a deviation from monogamy. It is important to explain the reason for this line of questioning and to help the patient understand that this is not an attack on his or her personally. This is a conversation that should be done by the same-sex provider, preferably alone. And some unmarried women may not agree to certain procedures, such as a pelvic exam or a pap smear, or anything invasive like that. Incidents of domestic violence may not be revealed because Islam prohibits mistreatment of women, and they may suppress this information. Abortion is permitted only in cases of threat to the life of the mother. A fetus is considered living after 24 weeks of gestation and is considered as a human being. And in general, most surgical procedures are permitted with no restrictions on amputations, biopsies, blood products, medications, other than what we mentioned before. So just a few recommendations that we need to be aware of the uniqueness of the Muslim in terms of their special needs. And it's always good to ask the patient and the family if they have any special needs and how you can make them feel more comfortable and more accommodative to their specific needs. Avoid being judgmental, be respectful and patient, and apologize for any cultural mistakes that you might make. Also have Muslim workers, co-workers who can assist in a culturally sensitive situation. Observe carefully the body and facial languages and train staff about cultural competency and sensitivity. Again, stressing the importance of gender concordant care, except in emergency situations where life and death decisions are being made. Sometimes male doctors may need to communicate through a spouse to a female patient, and they should be asked about that. Beards are religiously symbolic for males, and they may not want them shaved. So just be aware of that. A few words about the faith itself, so you can understand that Islam is a purely monotheistic faith and one of the Abrahamic faiths following Judaism and Christianity. And that only 20% of all Muslims worldwide are Arabs. In the United States, about 10% of the Muslim population is of Arab origin, and about 40% are African American in descent, and 40% come from the Indian Pakistani subcontinent. So they are not a homogeneous group, and different groups may have varying cultures and practices and behaviors that may shape what they expect from a healthcare provider. Some of the basic beliefs in Islam: that Muslims believe in one God, who we call by the proper name of Allah, which is the Lord of Abraham. And we believe that the Prophet Muhammad is a human being, a messenger of God, and sent as a guide to all of mankind, and the last in a series of messengers, which included Noah, Abraham, Moses, and Jesus, peace be on all of them. We believe in God's angels, His scriptures, and His messengers, and His revelations. The final revelation is the Quran. We believe in a day of judgment, life after death, and reward and punishment and accountability, which is individual. Some of the Islamic practices include what we call Islam as a complete submission to the will of God and His commandments. Muslims are required to pray 5 times a day, as we mentioned before, facing Mecca, and they wash their face, hands, and feet before prayer. The month of fasting of Ramadan that we talked about, pilgrimage to Mecca once in a lifetime, if the finance and health permit it, and giving an annual charity of 2.5% of your net worth to the poor and needy. A word about death and dying. Death is considered a part of divine destiny, and that its time is fixed. Euthanasia is prohibited in Islam. Autopsy is only permitted if there is a legal or medical reason. Organ donation is permissible. And prayer for the deceased and the burial is done as soon as possible without a wake. And therefore, a death certificate should be signed quickly to facilitate this process. Muslims celebrate their weekly holiday on Friday, where they have a congregational prayer, and 2 annual holidays, they are called Eid al-Adha, which coincides with the annual pilgrimage to Mecca, and Eid al-Fitr, which comes at the end of the month of fasting of Ramadan. So, in conclusion, The care of Muslim patients require meeting the needs of specific culture and beliefs, as Islamic beliefs affect the Muslims' patients' attitudes and behavior. Remember the ethnical diversity of Muslims, but their shared faith, which brings forth common healthcare challenges in a hospital setting. Muslims prioritize gender concordant care providers, providing food consistent with religious requirements is highly recommended, and a space for prayer. It is important for healthcare professionals to have an understanding of these issues to provide culturally appropriate care. However, it's important for medical practitioners to remember that preservation of life overrides these guidelines. In a life-threatening situations, there is no restriction of any kind. So keep that in mind, and I hope that this presentation has been useful. Thank you very much. God bless.